Welcome back to the Deep Dive.
Great to be here.
Today, we're really getting into a stack of your sources, notes, research, articles, all focused on understanding attention deficit hyperactivity disorder.
ADHD.
Yep, a big topic, lots to unpack.
Exactly. Our mission for this deep dive is to, go beyond the surface stuff, move past the misconceptions.
And pull out the key insights from the material you've gathered.
Right. We want to clarify what ADHD actually is, how it works in the brain, why it looks different in different people, different ages.
Sounds good. Where should we start?
Let's start right at the beginning, the terminology, because even for people who follow this, it can get confusing.
Oh, absolutely. The whole ADD versus ADHD thing.
Yeah, exactly. Your sources dive right into that, right?
They do. And they make it really clear. ADHD, attention deficit hyperactivity disorder. That's the official medical term now.
Okay. ADHD. So what about ADD? I mean, I've definitely heard that a lot. Where does that fit?
Well, ADD, attention deficit disorder. That's basically an outdated term now.
Yeah. It used to be used for the cases where hyperactivity wasn't the main thing, what we now call the inattentive type of ADHD.
Ah, okay. So ADD isn't really a separate thing anymore. It's just one way ADHD can show up under the main ADHD umbrella.
Exactly. That's a perfect way to put it. The official view recognizes three main presentations or types.
Which are?
The inattentive type, that's the one that used to be called ADD. Then there's the hyperactive-impulsive type.
Okay.
And the combined type, which, has features of both.
Got it. The notes have that simple equation. ADD equals ADHD inattentive type.
Yep, that sums it up nicely.
That clears up a lot right off the bat. So sticking with ADHD as the main term,
Yeah.
what do these different types actually look like psychologically, based on your materials?
Okay, so for the inattentive type, the sources describe people who really struggle to sustain focus, especially on stuff that isn't, super engaging or is repetitive.
Right, like chores or maybe boring paperwork.
Exactly. You see things like frequent careless mistakes at work, school, filling out forms, big challenges with organization, following instructions, or even conversations. They might get easily sidetracked, by things others wouldn't notice. And just general forgetfulness in daily activities, losing keys, missing appointments, forgetting to reply to texts.
That sounds like a very internal struggle. What about the hyperactive impulsive type? That sounds more outward.
It often is, more visible. This includes that physical fidgeting, restlessness. Sometimes it's internal, like feeling revved up inside, excessive talking, interrupting others, real difficulty waiting their turn, and that core impulsivity acting without really thinking it through.
And the combined type is just a mix of both lists.
Pretty much, yeah. Symptoms from both categories are present. This is often the one people picture when they think of ADHD because both the attention and the hyperactivity impulsivity parts are noticeable.
Okay. Now here's something the sources really emphasize, a kind of aha moment. It's this shift in thinking.
Ah, the regulation piece.
Yes. That ADHD isn't really a disorder of attention itself, like you don't have attention. It's a disorder of attention regulation.
That's such a critical reframing. It moves away from thinking of it as a deficit, like a lack of attention.
Right.
It's more about the difficulty in consistently directing that attention, controlling it, especially towards things that aren't immediately fascinating or urgent.
And this ties into the neurodivergent perspective, doesn't it? Seeing it not as broken, but just different wiring.
Exactly. The neurodivergent view says, look, this isn't a deficiency. It's a variation in how the brain is wired to handle things like time, motivation, incoming information, and self-regulation.
So the problem isn't necessarily the brain itself, but the mismatch. The mismatch between that brain and, say, a typical school environment or a rigid job schedule.
Precisely. The environment often isn't built for that kind of processing. The sources use a really good phrase. Attention is interest-based, nonlinear, and difficult to regulate voluntarily.
Interest-based, nonlinear. Difficult to regulate voluntarily. That perfectly explains that classic example from the notes.
The video game one.
Yeah. Why someone with ADHD can get lost in a video game for 6 hours straight.
Total hyperfocus.
But struggle intensely just to open and answer an email that might take 6 minutes.
It shows the attention capacity is there, sometimes huge amounts of it, but it's not reliably switched on or off by choice. It's driven by stimulation, novelty, interest. Not just by, I should do this now.
Okay, that's a really important distinction. But the sources also point out, rightly, that not everyone who struggles with focus has ADHD.
Oh, absolutely crucial. Other things can look similar on the surface.
Like what else can cause attention issues?
Well, the material lists several. Depression, for instance. It can cause really slow thinking, brain fog, lack of motivation that looks a lot like inattention.
Makes sense. Or anxiety. I imagine racing thoughts make it hard to focus.
Definitely. With anxiety, attention gets hijacked by worries. It feels fragmented. Then there's autism. There can be overlap in executive function challenges, but the reasons are often different. Maybe intense focus on specific interests or sensory processing differences. Trauma or PTSD can also disrupt attention. Things like hyperarousal, dissociation, intrusive thoughts, they all make concentration difficult.
And some really common things, too, like just being exhausted.
Huge one. Severe sleep deprivation. It tanks your working memory and sustained attention. It can absolutely mimic ADHD symptoms temporarily.
Right.
And don't forget substances or medications. Even too much caffeine or withdrawing from it or other drugs can mess with focus.
So with all these potential overlaps, what makes ADHD ADHD? What's the key difference, according to these sources?
The sources really highlight that ADHD is chronic. It's developmental, meaning it starts early. And it's contextually consistent, meaning the symptoms show up across different environments: home, school, work, social settings. It's not just in one place. The diagnostic criteria specify symptoms need to be present before age 12.
Okay.
It also typically involves that high responsivity to novelty, but a real struggle with structure. And fundamentally, it's linked to those neurological differences in how the brain handles reward, inhibition, and executive functions.
Let's dig into that neurological core then, because the sources are really clear. This isn't about willpower. It's about neurological dysregulation.
Exactly. It's not about trying harder. It's about how the brain's wiring actually functions.
So what parts of the brain are we talking about? The sources mentioned the executive function system first.
Right. Primarily located in the prefrontal cortex, the PFC. Think of it as the brain's CEO, or air traffic control tower.
Okay.
It's supposed to manage planning, organizing, prioritizing tasks, starting things, stopping impulses, using your working memory, regulating emotions, basically adulting.
And in ADHD, that control tower is what? Less active.
The sources point to reduced activity or maybe less efficient communication in the PFC. This leads to difficulties thinking ahead, poor impulse control, trouble shifting gears between tasks, forgetting steps in a process. There's a great quote in the notes. It's not that the person doesn't know what to do, they can't consistently deploy that knowledge in the moment. That's the PFC struggle.
That really hits that knowing versus doing gap. What about the CSTC loop? That sounds technical.
It is a bit technical, yeah. CSTC stands for cortico-striato-thalamocortical. But you can basically think of it as a key communication circuit, a kind of filter and feedback loop.
Involving the PFC again.
Yep, the prefrontal cortex, the striatum, and the thalamus. It's supposed to help your brain decide what information, thoughts, sensations is relevant right now and what it should ignore.
Like a noise filter.
Exactly. And when it's not working optimally, as often seen in ADHD, the filter is leaky.
Leaky.
Yeah, it struggles to filter out irrelevant stuff, so you get easily distracted by external things or internal thoughts. Sensory information might feel overwhelming. It's hard to prioritize consistently. Lots of internal static, a poor signal-to-noise ratio.
Okay. And the sources also put a lot of focus on dopamine and norepinephrine neurotransmitters.
Absolutely central to the story. The understanding is that ADHD brains often have lower functional availability of these key chemical messengers, particularly in those PFC and related circuits.
And dopamine is mainly about
reward, motivation, pleasure, and also attention switching. So low dopamine levels mean it's really hard to get motivated or sustain effort for tasks that aren't intrinsically rewarding, super interesting, novel, or urgent.
Which brings us back to the video game versus the email.
Precisely. And norepinephrine, that's more involved in alertness, vigilance, focus, readiness to respond. Lower levels contribute to that poor attention, stamina, distractibility, maybe even sluggishness sometimes.
And this is why stimulant medications can help.
Primarily, yes. They work by increasing the available levels of dopamine and norepinephrine in the synapse, essentially helping those brain circuits communicate more effectively, like turning up the volume on the signal.
Got it. There's also talk about the default mode network, the DMN.
Ah, yes, the DMN. This is the network that's normally active when your mind is at rest, just wandering, daydreaming, thinking about yourself or others.
Okay. And in ADHD.
The sources indicate it tends to be overly active or it doesn't deactivate properly when you need to focus on an external task.
So it's like the brain's autopilot keeps trying to take over.
Exactly. It keeps pulling your attention inward. This leads to those moments of spacing out, intrusive thoughts, losing your place while reading. It's that experience of, I was reading and suddenly realized I've been staring at the same sentence for 10 minutes. The DMN just didn't switch off.
Wow. And how does ADHD affect something like perceiving time or even your own body?
Great question. The sources talk about difficulties with time perception, often called time-blindness. It's a real struggle to accurately sense time passing.
So time feels different.
Yeah, it often feels like there are only two times, now and not now. The future feels abstract, distant. This makes planning, estimating how long things will take, pacing yourself, feeling urgency, incredibly difficult until a deadline is staring you in the face.
That explains a lot about procrastination. And interoception, what's that?
Interoception is your awareness of your internal bodily signals. Hunger, thirst, needing the bathroom, fatigue, even the physical sensations of emotions.
And that's disrupted too.
It can be, yeah. People with ADHD might not notice these signals until they're really intense, or they might have trouble interpreting them accurately.
Which could look like.
Seeming to overreact emotionally because the feeling built up unnoticed until it exploded, or maybe not eating until they're absolutely ravenous. It's a disconnect from internal cues.
Okay, one more neurological piece. Hyperfocus.
Mm.
This always seems like a contradiction, doesn't it? Attention deficit, but then intense focus.
It seems like it, but it's actually the flip side of the regulation problem. It's not controlled focus. It's getting stuck.
Stuck.
Yeah. When something is highly stimulating or interesting, that video game, a fascinating project, a deep conversation, the ADHD brain can lock onto it intensely. That's hyperfocus, like a dopamine tunnel.
Which sounds good.
It can be productive, sure.
Yeah.
But it's considered a symptom because the difficulty lies in shifting attention away from the hyperfocus when needed. You lose track of time, forget to eat, ignore everything else. The regulation, the ability to switch focus voluntarily is still the core issue.
Okay, so pulling it all together, the summary table in your notes really helps. Low PFC activity, control tower issues, poor CSTC loop, bad filtering, low dopamine, hard to get motivated for boring stuff, overactive DMN, mind keeps wandering, time and interoception issues, poor internal awareness and future sense.
Exactly. And remembering these are neurological patterns helps explain why it's not about laziness or lack of trying. It's how the brain is operating.
And understanding that helps explain why ADHD doesn't look the same in everyone, and definitely how it changes across the lifespan. The sources compare kids and adults really well.
It's fascinating how the core issues manifest differently.
Yeah.
That classic physical hyperactivity in kids running, climbing, can't sit still.
Yeah.
That often morphs into more internal restlessness in adults, like feeling fidgety, needing to pace, tapping feet, but maybe not bouncing off the walls anymore, or just feeling constantly on the go mentally.
And impulsivity, blurting things out in class as a kid.
Might become interrupting people, making impulsive purchases, maybe quitting jobs suddenly, or jumping into relationships too fast as an adult.
Okay, and inattention, zoning out in school.
Translates to things like chronic difficulty with deadlines, forgetting important meetings or bills, losing track of conversations, feeling overwhelmed by managing household tasks or complex projects at work.
The demands are just so different for adults.
Hugely different. Kids usually have external structure, parents, teachers telling them what to do when. Adults, you have to create your own structure for work, finances, running a home, maybe parenting.
Right.
That lack of built-in support often makes the executive function challenges of ADHD much more apparent and impairing in adulthood. It's why many people, especially women, don't get diagnosed until later in life when things start falling apart.
And emotional regulation. Still a struggle, but looks different.
Often, yes. Childhood meltdowns might evolve into things like intense frustration over small things, significant mood swings, difficulty managing stress, and that really painful rejection sensitivity dysphoria, or RSD.
Where criticism feels devastating.
Exactly. Perceived or real rejection hits incredibly hard. And hyperfocus is still there, but maybe it's on work projects instead of Lego, or deep dives into hobbies.
And the impact on self-esteem continues.
Oh, yeah. The negative messages kids hear, lazy, disruptive, not trying, can solidify into deep-seated shame, imposter syndrome, feeling fundamentally flawed or behind as an adult.
Why does it evolve like this? The sources mention brain maturation.
That's a big part of it. The prefrontal cortex, remember, the control tower. It's the last brain area to fully mature, often not until the mid-20s.
So some things might genuinely improve a bit with age.
Some aspects, like the overt physical hyperactivity, often lessen, but the underlying issues with inattention, executive function, time management, emotional regulation, those often persist or even feel worse because adult life demands more self-regulation.
And adults get really good at hiding it, right? Masking.
Yes, absolutely. The sources talk about adults developing complex, often exhausting compensation strategies. Things like meticulous planning, overscheduling, people-pleasing to avoid criticism, relying on adrenaline rushes from procrastination.
So they might look like they have it all together.
But underneath, it's often incredibly draining and unsustainable. It hides the core difficulties from others and sometimes even from themselves until they hit burnout.
No wonder adult ADHD gets missed or misdiagnosed so often.
It really does. It's frequently mistaken for chronic depression, which can definitely co-occur because of the ADHD struggles. Or anxiety again, often fueled by the chaos and feeling overwhelmed.
Or just dismissed as personality flaws.
Exactly. Oh, they're just flaky, unreliable, not motivated, too sensitive, disorganized, or simply labeled as chronic burnout without understanding the underlying cause.
Your notes list some key adult red flags that might get overlooked. Constantly starting new hobbies or projects but never finishing, being chronically late, big emotional reactions to small setbacks.
Yes, and also that intense dread or avoidance of simple, mundane tasks like answering emails, paying bills, doing laundry, extreme inconsistency in productivity, amazing one day, totally stuck the next, feeling utterly drained after socializing because of the effort of masking or tracking conversations.
So the reframe is powerful. It's not that ADHD disappears in adulthood, it's that it migrates.
Exactly. It moves out of the classroom and into your career, your relationships, your finances, your home management, your self-care. It impacts everything.
Okay, let's shift to another way ADHD looks different. Gender. The sources point out some really significant differences between how it often presents in men versus women.
Yes, this is a crucial area, especially for understanding why women are diagnosed so much later historically. There are definitely patterns.
Like the most common type diagnosed.
Right. In men and boys, the diagnosis is most often the hyperactive-impulsive or combined type. In women and girls, it's much more commonly the inattentive type.
Which leads back to those different behaviors we talked about.
Exactly. Men's ADHD might look more like restlessness, being loud, interrupting, physical impulsive, things that are externally disruptive. Women's ADHD often presents more internally, daydreaming, forgetfulness, feeling overwhelmed but maybe quietly, disorganization that might be hidden, trouble initiating tasks.
And that difference directly impacts diagnosis age.
Hugely. Boys often get flagged early because their behavior disrupts the classroom or home environment. Girls, especially if they're bright and trying hard to compensate, often fly under the radar. Their struggles are quieter.
So the boy bouncing in his seat gets noticed, but the girl staring out the window, lost in thought or forgetting her homework despite understanding the material, she might just be called spacey or needs to apply herself.
Precisely, that's the classic scenario. And emotional expression can differ too. Men might show more outward frustration, anger. Women often internalize struggles, leading to more anxiety, guilt, shame, that intense RSD we mentioned.
And masking, is that more common in women?
Significantly more common, according to the sources. Women often develop sophisticated masking techniques, perfectionism, people-pleasing, overcompensating, mirroring others to hide their internal chaos and appear neurotypical. It's exhausting.
Socially, the impact might differ too.
Yeah. Men might have more issues with overt conflict, maybe authority figures. Women often report more social anxiety, difficulty reading social cues sometimes, feeling like an outsider, and that deep fear of rejection.
Which leads to different common misdiagnoses.
Right. Boys might get misdiagnosed with oppositional defiant disorder or conduct disorder. Women are far more likely to be misdiagnosed with anxiety disorders, depression, bipolar II, even borderline personality disorder, or just told they're too emotional.
And their coping strategies might look different as well.
Yes. Men might use humor or risk-taking. Women often cope through overachievement, hyperorganization in some areas to compensate for chaos elsewhere, excessive planning, or self-blame and overthinking. This affects self-perception too. Men may be externalizing blame, women internalizing failure.
It really highlights why women have historically been so underdiagnosed. Cultural expectations play a huge part.
Absolutely. Girls are often socialized to be quiet, agreeable, people-pleasers. A girl struggling internally doesn't fit the old stereotype of the disruptive, hyperactive boy. Her quiet struggle gets misinterpreted.
And those masking skills are like camouflage.
Incredibly effective camouflage. Over preparing for meetings, meticulously planning social interactions. It takes immense energy, but can hide the underlying difficulties for years, even decades.
So generally speaking, external disruption, often seen in men, internal implosion, more common in women.
That's a pattern the sources describe frequently. The struggles manifest differently based on both internal wiring and external pressures and expectations.
And there's a really interesting point about hormones in women.
Yes, estrogen plays a role in modulating dopamine. This means ADHD symptoms in women can fluctuate noticeably with their hormonal cycles.
Like monthly cycles
Yeah.
or bigger life changes.
Both. Symptoms can worsen during puberty, premenstrually, during pregnancy or postpartum, and especially during perimenopause and menopause when estrogen levels drop. These hormonal shifts are often what finally makes symptoms unmanageable and lead women to seek diagnosis later in life.
That makes so much sense. You read those quotes in the sources from adult women diagnosed with ADHD and they resonate. I thought everyone struggled like this, or I always felt like I was almost successful but could never quite manage.
Yeah, or I'm either all in or doing nothing. I feel like I'm drowning, but everyone else thinks I'm fine. Why do I forget simple things but remember trivia?
Those really capture that feeling of inconsistency, the hidden struggle, the confusion, and the consequences of being missed or misdiagnosed are huge for women.
Huge. Chronic anxiety, depression, burnout, relationship failures, a lifetime of feeling not good enough or inherently flawed. It creates a really deep shame-based identity.
And the root cause, the sources say, is that historical diagnostic bias.
Fundamentally, yes. The early research, the diagnostic criteria, they were built mostly on observing hyperactive young boys. That became the prototype, the expectation. The quieter internal presentation common in girls and women just didn't fit the mold and was largely ignored.
Okay, let's shift gears again. Let's talk about causes. Where does ADHD actually come from? The sources frame it as neurodevelopmental.
Yes, originating in early brain development. It's not one single thing, but a complex interaction of factors. Nature, genetics, and biology plays a really significant role.
Genetics mainly.
Very strongly. ADHD is highly heritable. Estimates are often around 70–80%.
Wow.
Yeah. If a parent has ADHD, the child's chance of having it is much higher, maybe 40–60%. It's not just one gene, though. Multiple genes seem to be involved, especially ones related to dopamine pathways like DRD4 and DD1.
And the brain differences we talked about earlier, structure, neurotransmitters, that's part of the biological picture.
Exactly. Things like slightly smaller volumes in certain brain regions, delayed maturation of the cortex, those differences in dopamine and norepinephrine regulation, those are considered part of the biological underpinnings.
Are there other biological risk factors?
Some early developmental risks are associated with increased likelihood. Things like very low birth weight, premature birth, prenatal exposure to substances like alcohol or nicotine, possibly lead exposure. Severe early life stress or trauma might also play a role in some cases.
Okay, so that's the nature side. What about nurture, environment, upbringing?
Nurture doesn't cause ADHD, according to the sources, but it definitely influences how symptoms show up and how much they impact someone.
Like family dynamics.
Sure. A really chaotic, unpredictable home environment might make ADHD symptoms harder to manage. A structured, supportive, understanding environment can make a huge positive difference. School systems also play a role. A traditional setup can be a really poor fit for an ADHD brain, leading to struggles early on.
Now, the sources get into a really tricky modern question. Lifestyle and digital culture. How does that fit with causes?
This is where it gets complicated and where we need to be careful distinguishing ADHD from things that look like it. The sources suggest the apparent rise in ADHD diagnoses is likely due to a few things happening at once.
Okay, like what?
One, definitely better awareness and diagnosis. We just know more about it now. We're better at spotting it, especially in adults and women who were missed before. Professionals are more attuned.
Makes sense. What else?
Two, cultural and environmental pressure. Our modern world is intense.
You mean screens, notifications, constant information?
Right, exactly that. The hyperstimulating digital environment, endless scrolling, short-form video, multitasking demands, constant pings. It trains all our brains for novelty seeking and rapid attention shifts.
So it creates ADHD-like symptoms.
It can mimic them, yes. Even in people who are neurotypical, the sources call this pseudo-ADHD or situational attention deficit. It's a real phenomenon, but it's driven by the environment, not by underlying neurodevelopmental wiring differences.
So the digital world isn't causing ADHD itself, but it makes everyone feel a bit more scattered. and can maybe worsen symptoms for those who do have ADHD.
That's a good way to put it. And the third factor the sources bring up is fascinating. This mismatch between our evolutionary biology and modern life.
The hunter versus farmer idea.
Exactly. The theory is that our brains evolved in environments where scanning for novelty, quick thinking, shifting attention rapidly, maybe bursts of intense focus, were actually advantageous. Think hunters, gatherers.
So traits that look like ADHD might have been adaptive then.
Possibly. Maybe better suited to a nomadic past than to sitting still in classrooms or cubicles for hours. Society changed faster than our brains evolved.
So the ADHD brain isn't necessarily wrong, just maybe mismatched for a farmer society.
That's the provocative idea. Other potential contributing factors mentioned include environmental toxins, maybe diet gut health links, chronic sleep issues, the pressure cooker nature of modern work culture, maybe declining social supports. It's complex.
Which leads right into that big debate. Is ADHD overdiagnosed or just more visible?
Based on these sources, the most likely answer is both, to some extent.
How so?
It seems likely that some people experiencing intense stress, burnout, or the effects of that digital overload are getting misdiagnosed with ADHD when it's really more situational. However, it's also clear that many people who genuinely have lifelong neurodevelopmental ADHD, especially those with inattentive type, or adults or women, are finally being identified correctly after being missed for years.
So better recognition and environmental factors blurring the lines.
Exactly. The digital age makes ADHD symptoms potentially worse for those who have it, and it creates similar-looking symptoms in those who don't, making accurate diagnosis trickier but more important.
And the sources are really emphatic about telling the difference between this pseudo-ADHD and real ADHD.
Vitally important distinction. Real ADHD is described as neurological, starting in childhood brain development. It's lifelong. It impacts functioning across multiple areas of life: work, home, social, self-care.
And it's not just about focus.
No. It involves challenges with attention regulation, yes, but also impulsivity, emotional dysregulation, working memory problems, time-blindness, that core knowing versus doing gap. And these things are present pretty consistently, not just when stressed or on screens. It doesn't just vanish with a digital detox or more sleep, though those can help manage symptoms.
Okay, and pseudo-ADHD.
That's seen as environmentally triggered or exacerbated. It tends to fluctuate more depending on stress levels, sleep quality, workload, and especially the amount of stimulation in the environment.
So it's more about attention span being affected by outside factors.
Primarily, yes. It affects focus and maybe causes fatigue or distractibility, but it usually doesn't come with that lifelong history of core executive function deficits, the profound time blindness, the deep-seated emotional regulation issues, or the characteristic impulsivity of neurodevelopmental ADHD.
And pseudo-ADHD does tend to improve significantly with lifestyle changes. Better sleep, managing stress, setting tech boundaries.
Generally, yes. The sources offer some useful questions to help tell them apart, like, number 1, is this lifelong or recent? ADHD traits trace back to childhood. Pseudo-ADHD symptoms tend to emerge later or coincide with major life changes or stressors.
Okay.
2, does it affect multiple life domains? Real ADHD usually causes challenges across the board: work, home, relationships, etc. Pseudo-ADHD might primarily impact work productivity or focus during specific demanding tasks.
3, is hyperfocus present?
Yeah.
That ability to get intensely absorbed in something stimulating is common in ADHD.
Yes.
Less typical in pseudo-ADHD, which is more about generalized difficulty sustaining focus.
4, do breaks help, or how do they help? For pseudo-ADHD, stepping away from the screen or stressor often significantly restores focus. For ADHD, a break might help briefly, but the underlying regulation difficulty remains when returning to the task.
5, is significant emotional dysregulation involved? ADHD often includes intense emotional reactions, frustration intolerance, RSD. Pseudo-ADHD might involve frustration, but usually less pervasive or intense.
And number 6, how do you react to boring but necessary tasks? For ADHD, initiating these can feel almost physically painful, requiring immense effort unless there's external pressure. For pseudo-ADHD, they're unpleasant and hard, but usually feel more doable with conscious effort.
And clinicians use formal tools too, right? Like testing and history.
Absolutely. Neuropsychological testing can measure cognitive functions over time. A thorough developmental history is critical to see if these patterns have been present since childhood across different settings. Real ADHD shows that lifelong consistency. Pseudo-ADHD doesn't have that same developmental track record.
That phrase, ADHD imposter factory for the digital age, is really potent.
It is. Algorithms are literally designed to hook our dopamine systems, rewarding novelty and quick shifts. It conditions everyone towards fragmented attention. This makes it harder to see the real neurological condition underneath, which impacts so much more than just where your eyes are looking. It's emotion, memory, time, impulse, self-management.
And why is getting this distinction right so important?
Several key reasons highlighted. Overdiagnosis is one, people getting an ADHD label and maybe medication when the root issue is burnout or lifestyle. Underdiagnosis is another, people with genuine ADHD having their lifelong struggles dismissed as just too much screen time.
Yeah.
And medication ethics. Stimulants are powerful tools for ADHD, but using them for situational attention issues driven by environment raises different questions about necessity, side effects, and addressing the actual cause.
So the helpful reframe is ADHD, developmental neurodivergence, pseudo-ADHD, environmental attention strain.
Exactly. Both are real struggles needing real solutions, but the solutions differ. ADHD often needs a multi-pronged approach. Maybe meds, definitely coaching or therapy focused on executive function skills, environmental accommodations. Pseudo-ADHD needs lifestyle changes, stress reduction, tech boundaries, perhaps mindfulness.
Okay, so given ADHD is this neurodevelopmental difference, when does it actually become a disorder in the clinical sense?
It crosses the line into being termed a disorder, according to the sources, when these inherent differences in brain function lead to chronic functional impairment. Meaning the way your brain works consistently causes significant problems in meeting the demands of daily life, school, work, or relationships, when it persistently gets in the way of you functioning effectively or achieving your goals.
What are the main areas where this impairment shows up?
Often in work or school. Things like chronic underperformance despite ability, missed deadlines, difficulty organizing projects, maybe frequent job changes or dropping out. Relationships can be impacted by things like interrupting, forgetting important dates or conversations, emotional volatility, feeling misunderstood. Self-esteem almost invariably takes a hit. Years of struggle can lead to deep feelings of shame, inadequacy, imposter syndrome, feeling lazy or broken, and just daily life management, time-blindness causing lateness, disorganization leading to clutter or lost items, procrastination on essential tasks, problems managing money.
Those quotes in the material really capture it. I try so hard and still can't do what seems easy for others. Or I know what I need to do, but I can't make myself do it.
That's the core of the functional impairment. It's not lack of desire or knowledge. It's the gap between intention and action, consistently blocking you from the life you want, despite your best efforts.
Which leads to the big question people always ask. Is ADHD curable? Can you get rid of it?
The sources are very clear on this. No, ADHD is not curable in the sense of making it go away entirely. It's neurodevelopmental. It's the underlying brain wiring.
It is manageable.
Navigable.
Absolutely. Highly manageable. It's about understanding your specific brain wiring and learning to work with it, not constantly fighting against it. The sources use analogies like being colorblind. You don't cure it, you learn strategies and use tools to navigate a world designed for color vision.
Or being left-handed in a world set up for right-handers.
Exactly. With the right adjustments and tools, you can function perfectly well, even excel.
So symptoms can improve, you can function better, definitely. Significant improvement is possible with self-awareness, finding or creating environments that are a better fit, developing effective coping strategies, and getting the right support, which might include coaching, therapy, structure, and for many, medication.
Okay, let's talk about those coping strategies. These sources group them into different types.
Yeah, several helpful categories. First, structural tools. Because ADHD often impacts working memory and organization, the key is to externalize everything.
Get it out of your head and into the world.
Precisely. Use planners, calendars, phone reminders religiously, checklists for everything, whiteboards, sticky notes. Also, body doubling, just having someone else present, even if they're working on something else, can be incredibly helpful for getting started and staying on task.
Interesting. What else?
Time blocking scheduling, not just appointments, but specific work blocks, breaks, even chores. And using visual timers, like a time timer, helps make abstract time feel more concrete and manageable, combating that time blindness.
What about mental strategies? Mind hacks.
Some useful ones. The just start for 2 minutes trick to overcome task initiation inertia. A huge mental reframe is understanding activation before motivation. With ADHD, you often can't wait until you feel like it to start something non-preferred. You have to activate, just start, and sometimes the motivation follows.
Okay.
Also, gamifying tasks, turning boring things into a challenge or game with points or rewards, can sometimes tap into the ADHD brain's interest in novelty and reward.
And strategies for emotional regulation, that seems key.
Very key. Learning to simply name the emotion, okay, I'm feeling overwhelmed right now, can create a vital pause between feeling and reacting. Practicing self-compassion is huge, consciously reminding yourself that struggles are due to brain wiring, not moral failure. And therapy, especially cognitive behavioral therapy, CBT, adapted for ADHD or ADHD-specific coaching, can teach practical skills.
And then there's the medical piece.
Right. Medication, both stimulant and non-stimulant options, can be extremely effective for many people. The analogy used in the sources is good. Medication is like glasses for your brain, not a cure, but a powerful support when used wisely.
It helps the underlying regulation.
It helps improve focus, reduce impulsivity, and generally makes the executive functions work more effectively, allowing the person to better use all the other strategies.
So managing ADHD isn't a one-time fix, it's an ongoing process.
Exactly. The sources frame it as a lifelong practice involving self-awareness, plus environment design, plus compassionate strategy. You don't cure ADHD, you learn to collaborate with your brain. And when people find that sweet spot, they can absolutely thrive, often bringing unique strengths like creativity and problem solving to the table.
Okay, shifting perspective again. If you have someone with ADHD in your life, a partner, child, friend, colleague, how can you best support them? What do the sources suggest?
The absolute foundation, the sources stress, is to understand their reality. Really internalize that it's about regulation challenges. Brain wiring differences, not laziness, lack of caring, or poor willpower. Assume positive intent. Assume they are trying hard even when it doesn't look like it.
So less judgment, more curiosity.
Exactly. Be curious, not judgmental. Instead of asking, why haven't you done that yet? Hey, try asking, hey, seems like you're stuck on this. What's making it hard right now? Understanding the barrier is key.
The communication style matters too, right?
Hugely. Be clear and concrete. Vague instructions like clean up soon are harder to process than, can you start putting the dishes in the dishwasher in the next 10 minutes? Avoid shaming language. Just focus. Try harder. Why are you always late? It's invalidating and counterproductive. Check in on their emotional state gently. Overwhelm often triggers shutdown or paralysis.
What about helping with structure? It seems needed, but you don't want to become their manager.
That's the tricky balance. Offer structure without controlling. Help them externalize things. Want to sit down for 5 minutes and make a list? Or should we set a phone reminder for that? Encourage them to use tools like calendars or timers. Collaborate on planning, but let them own the execution. You're a support scaffold, not their replacement executive function.
And that body doubling thing again.
It works for support, too. Offer to just sit nearby while they tackle a dreaded task like paperwork or emails. Your quiet presence can provide accountability and activation energy without nagging.
And celebrating effort, not just perfection.
So important. ADHD brains thrive on positive feedback and struggle with criticism. Acknowledge the small wins, starting the task, making progress, trying again after getting derailed. Focus on effort and steps forward, not just the final outcome. It builds momentum and self-belief.
The sources make a really important distinction, though, between supporting and enabling.
Yes, that's a crucial line. Support empowers the person to build their own skills and systems for managing their ADHD. It fosters independence. Enabling involves doing things for them, constantly rescuing them from natural consequences, which ultimately prevents them from learning and adapting.
So support includes accountability.
Yes, compassionate accountability. Support encourages seeking professional help or using strategies. Enabling might involve making excuses for challenges or avoiding difficult conversations about responsibility. Support respects their agency while offering help. Enabling can inadvertently reinforce helplessness or make ADHD the central identity.
What are some signs you might have slipped into enabling?
The sources suggest things like feeling chronic resentment, constantly reminding them about the same things with no change, finding yourself unable to maintain healthy boundaries, or feeling like you've essentially become their outsourced brain, managing their life for them.
So the goal is clear. Support, not rescue.
Exactly, and the sources offer a really healthy mindset for offering support. I believe in you. I know this is hard. I want to help you find systems that work for your brain, not do it for you.
Thinking co-regulation, not codependence.
Perfect. Encouragement, not constant criticism or over-accommodation. Compassionate nudging towards tools and strategies, not nagging.
And you can gently suggest tools if they seem open. Pomodoro timers, apps, visual planners.
Yeah, or even suggest exploring ADHD-specific coaching or therapy if they're struggling significantly. The key is offering resources, not mandates.
Okay, as we start to wrap up this deep dive, the sources had a few bonus insights, some deeper cuts, maybe things less commonly discussed.
Yeah, some really interesting points. One is that ADHD paradox, motivation and willpower. It really underscores that intention-action gap.
Knowing what to do, wanting to, but just can't start.
Exactly. Unless there's that intense interest, novelty, urgency, or strong emotional driver. It explains so much about procrastination, inconsistent performance, and why many people with ADHD rely on adrenaline from last-minute pressure. It's not about wanting to, it's about the activation energy.
And the distinction between working memory and long-term memory.
Crucial. ADHD primarily impacts working memory, that mental scratch pad for holding and manipulating info right now. That's why you forget why you walked into a room, lose your train of thought, miss steps and instructions.
But long-term memory can be fine.
Often excellent, even photographic for areas of interest, which is confusing for everyone. How can you remember song lyrics from 20 years ago, but not what I just asked you to do? It's because different memory systems are affected differently.
Object permanence issues, too. Not just for babies.
Yeah, functional object impermanence. The out-of-sight, out-of-mind phenomenon on overdrive. If something isn't physically visible or highly emotionally relevant right now, it can functionally cease to exist for the ADHD brain. This applies to objects, tasks, even remembering to stay in touch with people.
Explains the need for visual systems.
Totally. Make it visible, keep it visible.
The sources also talked about identity confusion.
Yes, that feeling of, who am I really? That can come from years of inconsistent performance, masking, feeling like you're always falling short or pretending. It fuels imposter syndrome, shame, a fear of being found out, especially common in high achievers with ADHD who feel like frauds.
And the high rate of co-occurring conditions, comorbidity.
Very high. Sources often cite 60–80% having at least one other condition. Anxiety and depression are very common, often secondary to the ADHD struggles. Learning disabilities, substance use disorders, sometimes autism traits overlap. These can complicate diagnosis and treatment significantly.
Circling back to the hunter-farmer idea, ADHD as potentially adaptive.
Yeah, the sources explore this. In certain contexts, maybe fast-paced, innovative, crisis-driven environments. Traits like rapid scanning, creativity, thinking outside the box, performing under pressure, hyperfocus. These aren't deficits, they're strengths. It challenges the idea of a single normal or correct brain type.
And finally, that powerful concept of shame trauma.
This isn't formal PTSD, but acknowledges the real psychological impact of growing up or living as an adult, constantly feeling criticized, misunderstood, corrected, failing despite trying hard. It's the cumulative trauma of negative feedback associated with ADHD symptoms, leading to deep-seated shame and mistrust of oneself. Healing often involves addressing this shame directly.
Wow. Okay, we have definitely gone deep into this material on ADHD.
We really covered a lot of ground.
Yeah.
From the basic definitions and presentations right through the neuroscience, how it looks different across the lifespan and between genders.
To the complex causes, sorting out real ADHD from the environmental mimics, and understanding when it becomes a functional impairment.
And importantly, covering practical, compassionate strategies for managing it personally and supporting others effectively. Moving past that old idea of it just being about willpower.
Absolutely. Hopefully this whole exploration has given you, our listener, a much clearer, more nuanced, and frankly more compassionate picture of ADHD.
Yeah, moving beyond the stereotypes.
So as we wrap up this deep dive, here's maybe one last thought for you to chew on. Something from the edge of our sources. If we accept that many ADHD challenges stem from a mismatch between a particular brain wiring, maybe that hunter brain, and a society largely built for farmer brain styles, how might truly valuing the unique perspectives and capabilities of the ADHD brain lead us to rethink and redesign our systems, our schools, our workplaces, maybe even our daily routines, to be more flexible, inclusive, and ultimately more effective for everyone?
That's a great question to ponder. Thank you for joining us on this deep dive.
We really hope it's given you a shortcut to being truly well-informed.